Hello, everyone. My name is Rosalind Douglas, and I am the founder of Central Health Grenada, a grassroots initiative which seeks to educate nationals about chronic non-communicable diseases. Over the past few months, I had an online series entitled COVID-19 and Those Most at Risk. I chose that topic because research shows that persons who have a pre-existing condition, a non-communicable disease, if they contract the coronavirus, they tend to have a very difficult time. What you're about to view is a snippet of an extended interview that I did with Dr. George Mitchell, who served as the National COVID-19 Response Team Coordinator here in the trial states of Grenada, Carriacou, and Petit-Martinique. And he answered my frank question in this particular portion of the interview about non-compliant tourists. Our borders are opening in a phased process, but they are opening. And having non-compliant tourists can cause a major health risk for us in Grenada. You are going to be pleased with what he had to say. So I'm curious, as we wrap up, what steps are in place to make sure that the tourists in particular come in would be compliant? What pre-education would they receive? Because I'm coming in for sea, sand, and rum and everything else, and I don't feel like dealing with it. In fact, I came here to get away from all the madness, so I don't want to wear a mask when I'm here. But hey, you're putting our citizens in danger when you're not wearing a mask, even though they're there to offer you the greatest hospitality on the best island in the world. So what steps are in place to educate them before they get here? And secondly, what sanctions will be in place should someone be non-compliant?
So first and foremost, Rosalind, I just wanted to go at the core of that. We would love everyone to come here to visit Grenada, as you said, best island in the world, and I would not trade it for anywhere else, of course. But we also have to ensure that our people are safe. In other words, to continue to be the best island, we have to be safe. If you have to enjoy our sun, oil down and whatever else we have and the rum, you have to do that in a safe environment. So very, very, very important for us is the development of our protocols and to ensure that whoever comes here, we do whatever we have to do to make sure that you are safe, that those visitors are safe, and that our countrymen are safe as well. So part and parcel of the opening up, and that is one of the reasons why we have decided to open up gradually and safely, so that the protocol speaks to ensuring in this first instance that persons do have their negative tests, that they are negative when they land, because we are going to be doing rapid tests on them. And that if you're coming from what we have termed a yellow or a red zone, meaning that there's active transmission there, that you will be quarantined for a certain period of time. So unlike the St. Vincent experience, where people were allowed to go home, and they have their peculiarities about them, that they were allowed to go home, Grenada is not about to take that kind of chance. I'm sorry, no. We're not about to take that chance. If you're coming from an area where there is active transmission and you want to come and have fun, then your fun, of course, would be enjoying our beautiful island, but from your secured location until such time that you can go out and enjoy the rest of our beautiful island, being absolutely free. And we're ensuring that you are free to enjoy it and that we continue to enjoy it. So that is absolutely important for us, that persons ought to know that out there, that they're welcome to come anytime, but the protocols have to be followed because we want to continue to be beautiful and we want to continue to be safe.
Mm-hmm. And any sanctions for those who are not compliant? Has there been any arrangements for that?
Definitely, and I'm happy that you've raised this, because it was recently discussed at COVID, the committee's meeting. The sanctions that have been on the books for many, many years were deemed inadequate, just not enough to deter persons. And so this is going to be brought to Parliament but today is already Friday, so I suspect that very early next week, the fines surrounding breaking quarantine, etc., will be revised and will be implemented upwards, so to speak. And you know, since in March, when I looked at, for example, what Canada was doing, the Canadian fine was 10,000 Canadian dollars for persons found breaking quarantine. 10,000 Canadian dollars. And so our $1,000 was just really, really, really not a deterrent at all. And what the Canadian authorities did was to charge a few people up front to send a message out there that they were not, you know, about to joke with that. And I think it's important that, you know, that if such a situation occurs here, that persons are dealt with according to the law, so that it sends a clear message that we're not playing with the safety of Grenadians. So it is important. The fines are going to be revised upwards. I'm not exactly sure what that number will be, but it would not be $1,000 anymore. It would be way, way more than that. So as a means of deterrence, that is, you know, some of the measures that we're taking. We're ensuring that persons go into quarantine for the prescribed period, and that there are fines that are, you know, implemented to ensure that persons don't break quarantine. And of course, the quarantine have to be in approved accommodation. Approved accommodation. That is really, really important. We have the forms up online that persons can make the reservations before coming. We do have a little section, or we will be also affording some persons, but very selective persons, who in the main would have health issues, to stay at their homes once you know, that process is approved. We will be affording that. We have to be conscious that, you know, some persons aren't in a position to stay at those approved accommodations, mainly through health reasons. So we have made sort of like arrangements for that, but that would have to go through a process as well.
Just to say, of course, thank you so much for your service to our country. And I know you have another leg to move forward to with the borders opening and keeping us safe again. But just thank you so much to you and your team for everything that you've done for us. And I will end today's session. This is Rosalind Douglas with Central Health Grenada and our online series, COVID-19 and Those Most at Risk. Thanks for joining us today.